Okay, so we have a question from the audience. Let's get into that.
Yeah.
So the question says, Sir, my brother is having a lot of pain in the abdomen area.
hmm
Is it kidney stones? Should we get it checked by a specialist?
Okay. I mean, very good question, and thank you, viewer, for providing this.
Mhm.
Um, again, that is kind of a vague symptom because pain can reflect a lot of things. So when I'm worried about kidney stones or something with kidneys. A lot of times, the pain is usually in the flank area, in the low back flank, and sometimes it can radiate into the groin. So, if that's the type of pain that they're experiencing, it can potentially be a stone. I mean, it's hard to say, but now we look at have we had any previous history of kidney stones in the past? That's going to be important. Is there a family history of kidney stones in the past? That's important. Have we had any blood in the urine? That's usually and can be one of the first signs of having a kidney stone. So typically the story is all of a sudden I wake up and I'm having excruciating pain that's in the flank, low back area, radiating to the groin. My suspicion for a kidney stone is high. But again, there's no numerous things that can potentially cause abdominal pain. Of course, we think about gastric pain that could be, ulcers or gastritis. There's your gallbladder, which is in the right upper quadrant. You can have issues with the intestine, like diverticulitis. So it's a vague question, but again, I guess by probing into exactly where the pain is, we can probably better guide. But definitely, if the pain is persistent, I would suggest that this needs to be looked by either your primary care physician or even a specialist. And sometimes a simple test, like an ultrasound, and sometimes we do a CT scan without a contrast. These are some of the basic tests to kind of look at it to see if there's a stone. We sometimes do an X-ray as well just to see. But very difficult to kind of pinpoint if that's exactly what's going on. But my advice is if the pain is persistent, we do need to follow up just to make sure.
Mm-hmm. Sir, what are kidney stones essentially? Like, what causes them? Can we get into that a little bit?
Yeah, kidney stones are essentially crystallization of certain structures, and usually, if you analyze these stones, it's made up of a couple of things. The most common thing it's called a calcium oxalate stone, and basically, it's supersaturation of the calcium and the oxalate crystals in the kidney, and then which become bigger and bigger and forms a stone. Sometimes when we look at the urinalysis, when sometimes a patient comes in and I do a test on the urine, we can start seeing some crystals in the urine. That doesn't necessarily mean they have a stone per se, but it could be the beginning of a stone. Um, there a genetic component to it? Yes, there are certain conditions like cystine stones, which can be passed down from generations to generations. A lot of times, is there things that the question would be, okay, what are some things that we can prevent stones from happening? Well, typically, the first and foremost therapy would be staying hydrated, and keep in mind, there are going to be patients who are, um, they're stone formers, they have a genetic tendency to form kidney stones. So if we have someone in that scenario, the most important thing is they have to stay hydrated. So typically I recommend, about 2 liters of fluids a day. Another very, very important piece here is limiting the amount of sodium in their foods. You have to, and I think this is going to be a repetitive scenario, or my advice is, limiting salt. A lot of things that we deal with kidney disease, we have to cut back on the salt. So increasing your amount of water, limiting the amount of salt, that's going to be the most common advice that we typically say. Typically, another thing that can help potentiate stone is if you're not having as much citrate, in the urine itself. And these are certain tests that we do to kind of evaluate certain risk factors for having stones. But typically, I would say, hey, make sure you use like freshly squeezed lemon in your water. So lemon water, it's very important in helping reduce stones. These
Okay,
crystals.
Good tip. Yeah.
Oh, sorry. Please interrupt me. I'm a talker.
Oh no, I'm sorry. I didn't want to
Uh,
interrupt you, but like I've never thought about lemon water having like such a big contribution to our kidney health. Yeah, so
Yes, these are strategies. I mean, of course, there are certain medications that we typically use as well, but these are the first go-to steps, if we're concerned about stones, typical advice that we want to do.
Mhm. And what would you say is the treatment? Like, do people require surgery for this, or do they
Oh,
pass it themselves
yeah.
usually?
Oh, yeah. A very, very good question. Again, this really depends on the size of the stones. Let's say and typically we would say like about 5 millimeters or less, you should be able to pass it. 5 to about 9 millimeters on the average, you will pass it, but it will be very, very painful. Beyond that, then we need to have urology involved, and urologists can actually go in and they do certain procedures like shock lithotripsy, or they send in shock waves to break it down. Now, of course, if there's a stone that's causing an issue with the urine flow, that could potentially be an emergent procedure where we'll have to get the assistance from our urologist to do a procedure where they'll go in and extract the stone.
Uh-huh. Okay, I think that sums up kidney stones. So we're gonna be concentrating on the diet and stay hydrated. I think that's the key takeaway from
That's
this,
the
right?
one of yes, that's definitely the takeaways if you've had, especially if you're a stone former. And then if you have again, just quickly, just to add, like there are other risk factors. For example, someone who has gout problems, or if their uric acids are high, there's certain medications that we would target to lower those. Yeah, yeah. I mean, again, importance of following up with the nephrologist and staying very close to your primary care physician, doing a routine test and stuff. This is where all these things come to play.
Okay, thank you so much. I think that's excellent advice.